Welcome back again. So for this particular video, I'm going to talk about transitions of care pharmacy practice as a new frontier in integrated patient care. And I know this is not a concept that people talk about as much, but it's something that needs to be looked into. And as pharmacists, in terms of our practice, we need to be asking ourselves, how do we integrate our service delivery models into the transitions of care? And therefore, for me to get into this particular discussion, the question we need to ask ourselves, what is it this TOC pharmacy practice as well? What is the transitions of care? So I'm going to take it from a story perspective and looking at reflecting on our common models of healthcare service delivery. We know when you're unwell, oftentimes we go to pharmacies to buy our medications. When you go to a pharmacy to buy medicines, you'll either buy the medicines that you came up in going mind with, or the pharmacist will seek more information from you to help you get the right medication that would help in treating your condition. Hopefully it works for you. Alternatively, you might find a situation where if the pharmacist is not able to make a clear diagnosis, and therefore they would not be able to give you any medications, but instead they would refer you to either go to a physician somewhere or go to a laboratory somewhere for a number of investigative tests, upon which you'll be sent back either to the pharmacy, in that particular pharmacy where you started from, or to another pharmacy or another hospital where you're going to get your care. So that is part of the referral care. And then the other bit would be, you've been unwell, you've been admitted in a hospital, you've been taken care of, and upon discharge from the hospital, you're told to go to the pharmacy to buy your medicines and you go home. That is transition of care. The other bit would be, you've been sent to go home, but continue your clinics within a local primary healthcare facility, or go to a pharmacy where you'll be managed. If you're suffering from a chronic condition, you're told, over a period of time, you'll have to be refilling your medications because you need to use them lifelong or for a long period of time. And on that account, then you need to be getting your medicines from another pharmacy, whether in a primary healthcare facility next to you or a community pharmacy that is close to you, where you'll either be buying them or paying with them through your insurance cover. So these are transitions of care. And when you talk about transitions of care, you're looking at it from, you've been managed for your medical conditions at a particular level, but now you're moving to the next one. From a pharmacist practice, we're looking at TOC in pharmacy practice, transitions of care pharmacy practice as your role in this transition where a patient is coming from either your pharmacy to a hospital, to a physician, or to a lab, or you're a pharmacist in a hospital, the patient is leaving you at the discharge from the hospital, going to either continue their medication at home, to continue their management from a primary healthcare facility, outpatient services, or they are going to a particular, let's say, rehabilitation center, depending on the condition that they need and then care needs that they have. So when we look at that, then we need to ask ourselves, then what is your role as a pharmacist in TOC pharmacy practice? In transition of care pharmacy practice, it is about you as a pharmacist being able to deliver pharmaceutical care services within that transition of care, either referring them from your pharmacy practice to a hospital setup inpatient, referring them to a laboratory for diagnostics and investigational services, referring them from your inpatient hospital as a clinical pharmacist, where they're now moving to the community, to their home, moving to engage with the primary healthcare center, going to a pharmacy to buy their medications. So how do you make that experience meaningful and worthwhile and make it improve the quality of outcomes? And then some of the key drivers that have been that kind of a care that we're looking at. How do we ensure the transition of care pharmacy practice is integrated and of value to the community and to the patient healthcare system? Is because we've acknowledged that from different studies that have been conducted, one, with a gap in the transition of care, we have so many patients being readmitted within 30 days of discharge. So you discharge a patient today, next week, they're back into the hospital. That is not good for anyone because that patient, as is a person, they're not able to bond with their families where they need to be bonding and staying with them. They're not able to go back into meaningful, productive work because they are being readmitted into the hospital. The whole cost of healthcare is going to be higher because these healthcare services have to be paid for. But then the other cost is in terms of the lost work days, lost productivity, lost value in terms of the relative or the guardian who is going to come and check on them every other time, saving on not being meaningfully engaged in the economic activity wherever they are. So there's a lot that we need to look at in terms of what is the cost of poor management of the transitions of care, and what are the challenges that we normally acknowledge in this area. Some of them involve either the patient was not properly educated in terms of the use of their medications, and because they didn't understand it better, Some may not be able to comply and adhere to their medication regimen as provided. And if that happens, they're not going to use that medicine, they're not going to get better. That is a flaw in our own healthcare system. The patient might have been educated well, yes, but there's no referral mechanism where they're going to buy the medicines. They probably go buy medicine from another outlet that may not meet the needs in terms of quality, safety, and efficacy of the medications. They are taking medication, yes, but it is not effective for them. That is a flaw in the system, and that is a challenge. They are leaving the hospital, probably, let's say, for example, some of the drivers in terms of the social framework where they operate. They've been suffering from drug use and drug abuse, but when you're sending them back home, you didn't get to understand this social environment where they come from. And therefore, there were no containment measures around helping them not relapse into that problem. And therefore, when you're sending them back home, they're going there, they find the first person they meet is the friend who they used to drink with. What happens? They're back to drinking. Is it going to realize our positive outcome that we hoped for? Definitely not. It means after a week or two, they're back into the rehabilitation center to be supported in their recovery journey. So how do you do that? How do you integrate them into social networks, social frameworks that are supportive for their care? Then the other bit is in terms of breakdown in communication. And when we look at breakdown in communication, you refer a patient from, let's say, a community pharmacy to a hospital, but then there's no supporting documentation that is going to give the physician, the triage nurse who is receiving them, or whichever the kind of professional they are meeting in the next care facility. And therefore, they don't know what investigation should I do or which one should I avoid. What medicines have the patient been on, and how can I improve on that care? Probably the patient was administered some medication and 30 minutes or even 1 hour before, but this is not documented. Therefore, when they get to the hospital, looking at the severity of their condition, the healthcare provider again just administers another set of medication that is already going to be overdose or fail in terms of interaction that might arise again. There's that kind of communication. Are you relaying the information that needs to be sent to the next care provider? Then, so that is on communication. We need to ensure that patient communication is optimal. Communication from one healthcare provider to the next one is optimal as well. And then we now see breakdown in accountability. And this is one of the key things that we've seen being discussed in our healthcare environment, especially around emergency care. A patient was unwell in one hospital, being transferred from one to another, an ambulance was called, and the ambulance takes the patient to the next facility. There's no supporting nurse, no pharmacist, no physician. So in other words, the patient has been abandoned in an ambulance to take them from one hospital to another. Who is going to take responsibility in case anything happens across the road, along their journey to the next hospital? Those are the gaps, and these gaps need to be addressed. And when we look at it from that dimension, we're asking ourselves, where do we come in as pharmacists? You're in the hospital. Are you able to review the patient medication before they are discharged from your hospital? Yes, you're able to review that medication, have an engagement with the clinical care nurse, clinical care physician that you're working with, so that you optimize the treatment plan for that patient. Have a listening ear, have the personal touch with your patient. Once you finalize on that phase, now the point of discharge. Last, with probably one, they need a social care support. There are social workers in the communities where they come from. In certain cases, we could refer to them as the community health workers, community health volunteers. Can we interact with them and tell them, by the way, for this particular patient, these are their needs, and for them to be able to respond better to the management plan, we need somebody who will walk that journey with them. And that person who is going to walk that journey with them has to be you, because you are closer to them and we think you're able to support. Therefore, it's going to be made better and the patient will get better. That is with the social care worker. You're referring them to continue their management from an outpatient clinic, probably next to their neighborhood. Let's say they've traveled over 10, 20 kilometers to get to your hospital where they were admitted. Now, when they're going home, there's a hospital 1 kilometer away from them. You are recommending they go back for their follow-up management there. How do you make that communication clear? You need to send documentation to that facility, indicating that I'm referring this patient to you for continued management for their condition. That communication has to go. Once it goes there, you need to have somebody who is taking responsibility to ensure over time the patient will get the optimal outcome. Because if you don't facilitate that kind of communication and there's a standard agreement in place on how that care is going to be delivered, there will be lapses. And those lapses can cost a life, can cost in terms of the livelihood of some people, and can ultimately compromise on the quality of care that we wish and hope for. So how do we address these challenges? Even pharmacies, which pharmacy will be refilling the medication with their particular brand that works for them or not? How do we ensure that they continue engaging in case somebody has any severe conditions in emergency care? Who do they reach to, that kind of a patient? Probably they have an advanced event when you change their medication at the point of discharge. Then they have an allergic reaction or any other adverse event, and they stop taking the medication. It will be a failure on your system. So you need to see, how am I helping these patients respond better, get better outcomes, and realize the best of quality outcomes that we're hoping for. So those are the kind of things that we need to be asking ourselves. How do we make it work for us as pharmacists, and what kind of areas do we plug in? And the reason as to why I'm talking about these as our areas, pharmacists, we need to play a critical role, is because oftentimes when you interact with people who have been unwell and they went to a hospital or healthcare facility and they got care, their measure of treatment is, I got some medicines which were prescribed to me or dispensed. So if they got medicine, they were treated. If they didn't, probably they were not treated. Who is the medicines expert? Definitely it's you as a pharmacist. When they leave the hospital, the last point of contact oftentimes is the hospital pharmacy. They're taking their discharge medications. Who is at the discharge medication desk? That is the pharmacist. So it therefore means you are the last point of contact. You are able to guide them on how they are going to continue their care beyond the hospital. So why don't you do your work? So those are critical bits that we need to be keen about. Where do we play? How do we play? And how do we make it optimal for us? We're talking about primary healthcare services and the critical role of pharmacists in primary healthcare. There was a video that I did about this. Ask yourself, in the primary healthcare setting, people coming to you, they need help, they need additional support. Can you take advantage of that and actually even refer them for additional care? And for us to do all these, as we're talking about the good thing that we can do in the transitions of care pharmacists, we need to ask ourselves, how do we model it to be a standing practice? Because one thing that we know, it's not something that is standard practice for us. And not being standard practice means there are lapses. So one, we need to structure transitions of care as a key component of our practice. One of the key things that I talked about in one of the previous videos was the fact that one, we need to know and have a service charter that outlines what is the scope of our practice in whichever setting we are working in. Once you have a service charter, things that are beyond us, the additional services that patients might need that are beyond us, we need to have structured engagement with other healthcare practitioners and facilities that are able to offer those services. Therefore, we have an institutional framework and an agreement within which we operate as healthcare service providers. Once we do that, we have a service charter, we have engagements with people who might offer additional services that are without, beyond our scope of service. Then now let's go to the next thing. In transition of care, when I am referring to a patient from this organization to the next, what is the standard operating procedure that is guiding me on what information I need to provide, where I need to send the patient, who is responsible for that referral mechanism, who is accountable for everything along that journey? When is it supposed, when do I consider my transition of care role over? Is it at my pharmacy when I'm telling them, go to this pharmacy and leave it at that? Or should it be at the point where I've handed over the patient and the clinical care plans that I've been working with to the next healthcare provider? So those are the kind of frameworks that we need to have in place. Once we've done all that and put in place those institutional infrastructure guiding documents, that is the SOPs, the checklist that will be verifying that, well, I provide the treatment plan, I indicated the number of medicines the patient have been on, I know their care plan, I know there's a responsible guardian who probably brought them to the hospital and who will be leading in the terms of their care, who is financing that care. I indicate all that information. Then we need now to look at how do we incentivize pharmacists to take up more of these responsibilities and make them be a critical role of what they want to do, how they do it better. The incentive model. What is the remuneration model around offering transition of care services? It's additional work, but it's ultimately leading to success in terms of the quality. So if we're losing substantial amounts of money by failing to offer it, then it means we can use the same or even less amount of money to remunerate the pharmacists who are offering these services and improve on care delivery for the patients. And then we need to have clear key performance indicators, performance metrics. And key performance metrics which should be outcome-based. If you offer these services and we've seen the quality in terms of the social workers who are supporting, the nurse who is going to take care of them, let's say it's home-based care, so that we are seeing the ultimate aim of our transition of care pharmacy practice is improve the quality of care for the patient, improve their wellness, and serve them to the ultimate successes. And I think these are new advances that we need to be asking ourselves as pharmacists. Are we getting into that space? How are we going to play our role? And are we going to do it just from a basic minimum, or are we going to do it at another level? And then once we institutionalize it and see how it's working, the next thing is let us champion for policies and strategy local national frameworks that are going to make them standing practice areas and make them be a core beat in terms of pharmacy practice, bill, or whichever guiding framework, depending on the country where we operate. When we do this, I believe we are going to serve our patients better. We're going to improve the quality of care for ourselves, our patients, and advance the profession of pharmacy and create more room for pharmacies and bring it to where it needs to stand. Be where it's a revered profession, a valued one that is of service to the community where we work, to the people who depend on us to make the right decisions with the right support frameworks to get them where they need to be. If you've enjoyed these, I urge you to subscribe to the channel, engage and share with your peers and your networks who find value in sharing such kind of pharmacy information, pharmacy practice trends, and are willing to revolutionize the practice of pharmacy in the areas of work. Thank you so much. I hope this now gets us back on track on where we need to be and how we need to advance the pharmacy practice. If you need more guidance, we are able to support. Reach me on africanpharmanetwork@gmail.com. Thank you.